All right, welcome everyone. As I mentioned before, if you can put your camera on, please join us. We'd love to see who's in the conversation with us today. I know some people also are on the move. I think Delissy mentioned she's on the move and others, and it's going to be like a podcast for you today. I promise it'll be an actionable podcast, a lively podcast for you. And thank you so much for making time for all of you. I'm Atin Rayaleen. I'm the founder of the Proximity Project, and I will be moderating this conversation today with an esteemed set of panelists they'll introduce themselves in a moment. I wanted to, as we're kicking this off, first I'll introduce what the Proximity Project is, and then I also want to speak to kind of how a lot of us are walking into this Zoom conversation today. But let me start for anyone who is not familiar with the Proximity Project. I founded the Proximity Project in 2020. We all know, right, how we were reeling around healthcare, around the pandemic, and also George Floyd's murder, Ahmaud Arbery, everything that was going on in 2020. And there was this continued conversation around what should we do? How do we push for racial justice? And a big thing that I wanted to add to that moment was it's not enough just to talk about diversity, equity, inclusion. You have to truly be proximate to the most marginalized voices, and that's a diverse. Today, you're going to talk about indigenous populations. We're going to talk about Black males in the profession. We're going to talk about a lot of different things, but you have to push yourself, be proximate to the need, to the place where you have a deeper understanding and you feel it viscerally. And a lot of what I was experiencing through personally and through the community I live in and I work with was a lot of intellectualizing around these things, or a lot of performativity. And as we're looking where we are coming into this conversation now, it's kind of what I was feeling at the time, that we needed to push for deeper proximity, push for deep and authentic ties to the most marginalized in a way that would lead to real and true change. And so we created the Proximity Project, an 8-week cohort experience. We started with education and philanthropy, and then we brought it into the healthcare space. And at this point, Morgan might drop it in the chat, we've had 300 people go through the program as of the cohort that is going on right now. If you were alum of the Proximity Project, or you're doing it right now, can you please raise your Zoom hand, if you know how to do that, or your real hand, and applaud you for doing that, participating, doing the work. As I say, hashtag do the work there in this work. And I see Mike Eppiheimer and Ms. Deborah Yanez, who have co-facilitated the Proximity Project and allowed it to and been a part of the education process for so many leaders as well. And so that program, we do that twice a year. We're doing one now that has a few more weeks left of this cohort. Morgan might also share that this Friday is open session for anyone who wants to kind of experience what that looks like. And then we do another cohort of the Proximity Project in the spring. So I'll say that that work has been, it's work that I've been giving of myself, and my team has been giving of themselves, but it also has given back so much to me, especially because well before what happened yesterday, there's been there's been attack on DEI. There's been attack on a lot of progress around racial justice and social justice, and it hurts. But I also continue to derive strength from folks like you guys who are coming to things, who are applying yourselves. I continue to remind myself, right, that we are creating change. And there's strength in the numbers and the organizing of ourselves together. And so coming in today, I know people are coming in with a lot of fears and emotions and pain. And we will continue with our conversation. We're going to adapt it as the spirit leads. The panelists that you have here. We're going to be talking about healthcare. We're going to be talking about nursing, but it all intersects, right? These are artificial silos. All of these, the education system, the criminal justice system, immigration system, all these connect. And so I'm excited to see what the panelists can offer at a time when a lot of us are looking for guidance, looking for strength, looking for community. So thank you all for showing up. today. So I want to jump right in because we have a few panelists and I want to make sure they have time to share the things they want to share. But one of the things that I wanted to ask you is how many of you have seen the documentary, Everybody's Work, that we were kind of featuring today, and the panelists have were featured in this. How many of you seen it? Few of you have seen it so far. Wonderful, wonderful. Okay. What I will say is that if you're attending today, Morgan can post in the link in the chat if you're not, a link and a password to be able to screen the documentary. It is really, really powerful. You'll get a preview of today through that conversation, what you'll get there. And I encourage you all to check it out, to talk about it, and to keep the work and the conversation going on after this. What I also will say is if you can stay to the end of the session, we will also be we'll be drawing some names to give away a few copies randomly. Morgan's going to spin his wheel for a book related to this theme called Black Angels, The Untold Story of the Nurses Who Helped Cure Tuberculosis. We had a session with that author several months ago. Would love to get that beautiful book into some of your hands as well. So stay to the end. You got to be here, I think, Morgan, right, to be entered into that drawing, and we're going to keep it moving. So I want to jump in and ask our panelists if they can introduce themselves, and if you can introduce yourself. Maybe I'll start with you, Dr. Grant. If you can introduce yourself and share more about your work, your work towards racial and social justice that you lead in the healthcare community. And given how what we are going through as a country, if there's anything you want to share about how you are entering this conversation today, please do that as well.
Well, thank you very much, and delighted to be here. And good afternoon, everyone, for those of you on the East Coast, and good morning to those of you on the West Coast. My name is Dr. Ernest Grant. I'm the Vice Dean for Diversity, Equity, Inclusion, and Belonging at the Duke University School of Nursing, and I'm also the immediate past president of the American Nurses Association, which is the nation's largest nursing organization. And actually, during my tenure as president, I was president during COVID and the 2 years after that. But it was during that time that we began to look around, as Atenya mentioned, with the murder of George Floyd and other Black and BIPOC people across the country. We began to look around to explore racism within the nursing profession. And subsequently out of that grew the National Commission to Address Racism in Nursing. And that work is still going on as we are doing that. But as we were doing the work to establish the commission, one of the things we did was held listening sessions. And the stories that came forward from people who had long suppressed the prejudices that they had endured was just absolutely amazing. We heard stories of people saying, when they were being interviewed for nursing schools, that people like you have a difficult time getting through this program, or even in my own instances, being when I was floated to another unit and being mistaken for someone from housekeeping or someone from dietary. And then when you say, no, I'm a nurse, I'm here to help you, then the next question was, oh, well, what school did you graduate from? As if that would determine your qualifications or worthiness to be on that particular unit. And I told him I'd be just as happy to go back to my home unit if you don't want my help. That's that's not a problem. But I have been a nurse for almost for 47 years. Started out as an LPN, and really during that time, back in the mid 70s, looking around, first of all, there weren't many people of color who were in the profession. Black men who were nurses, Black nurses at the time made up probably about 3% of the total nursing profession, and Black men were even less. And even though there's been some growth in the ensuing years, that is still the picture right now. Nursing is viewed as a predominantly white female profession. ethnic minorities make up about 20% of the practicing nurses in the country. And I am on a task, if you will, to try to increase the presence of men and ethnic minorities within the profession, because I'm a strong believer that nursing should be reflective of the people that we care for. And as we're seeing the browning of America, even though people may try to stop it, it is going to happen. We need to make sure that there is that representation. And so that is what I'm bringing to the table. I've spent the majority of my nursing years, as an activist, as I said, trying to get more men and ethnic minorities within the profession. And we'll continue to do so until I officially retire. And when that will be, I don't know. I failed at retirement twice already. So, but that's pretty much it. And I, looking forward to having some discussion with my colleagues. So I'll just stop here and then maybe pass it on to Dr. Frazier.
Thank you.
So first of all, Sonia Frazier, Chakasha Micha Chachasiya. Hello, my name is Sonia Frazier, and I am Choctaw Chickasaw, and I am the president of the Oklahoma Indigenous Nurses Association, which was founded in 2021. Again, during the time of COVID. I do live in Oklahoma, which we have 39 tribes within our state. And I do work for the Indian Health Service. And I had previously worked for my tribe as well. And my experience with dealing with racism began with my life because I was born within the Indian Health Service system. And the health care that I grew up in, it wasn't the best health care that we saw. And there was a lot of racism within the healthcare system. And also within the educational system in Oklahoma, because Oklahoma, we have the highest number of boarding schools that were in our state. And that's all related to the attempted genocide and assimilation of our people since the beginning of the arrivals of Europeans. And we have been trying to recover from that. And with my experience in nursing, I went into nursing because of my mother. And I try not to get emotional, but I always do every time I speak about her because both my parents are boarding school survivors. And it took a lot of healing for myself because I had to go back and learn about their history, which continued on all the way back until the arrival of Europeans. Because looking at our family dynamics, all the health disparities that we see in the indigenous population, my mind is always the question of why. Why do we have all these health disparities? And whenever you look at these disparities, it usually goes back to racism because we were devalued, we were dehumanized, we were seen as not using the land properly. But the way we feel about the land is it is our relative, it is our mother. So we have a different respect and different connection to the land. And it's just advocating for all of our people, for all of human beings to have the right to exist, to have the right to believe the way you believe. And coming into today, Morgan sent out an email earlier asking, just to be aware of today. And it was very hard. My heart was broken this morning. I received a phone call from my brother because he knows how passionate I am about this work that we're all doing. And he just told me to get up. He said, don't give up the fight, because what we are all doing here in this sacred circle today is so important that we keep moving forward and that we just pull each other along. And I will be there for all of you. I'm looking forward to this hour to share with all of you. But again, thank you for inviting me to be here today. Thank you.
Sorry, Sherry, thank you so much for sharing a piece of your story and also for those words of encouragement. I want to bring in Aaron to the conversation. Same question.
Hello, all. Good morning from Sacramento, California. My name is Aaron King. I'm currently an assistant nurse manager at UC Davis Health, Trauma One Hospital here in Northern California. My entry into nursing, I've been in nursing for 12 years. I spanned as far as med-surg, telemetry, ICU, and now in a role in leadership. I got kind of into the work as I was preparing for graduate school. I was introduced to Capital City Black Nurses Association, which is the local National Black Nurses Association chapter here in Sacramento. And from there, the wheels just got turning. So I got very active in the organization. National Black Nurses Association has been around since, I believe, 1971. The organization sits on pretty much 3 pillars. We are really focused on outreach, education in Black communities, then also supporting the current workforce through scholarship, mentorship, training, etc. And then thirdly, really looking at how we can recruit more Black men and women into nursing professions so that we could best serve our communities. Currently, I serve as a historian for my local chapter. I started in as the secretary. The programs I'm involved in, I think that is one of the programs which they were interested in to have me featured in the film was the Breaking Down Barriers Pre-Nursing Conference, which is a collaboration between local chapters of the Hispanic Nurses Association, the Filipino Nurses Association, and the Hmong Nurses Association. And we just had our 4th event in September. I believe we had 150 students, high school seniors, juniors, and second career adults. And we brought in local nursing programs around the region. So I think we had about 15 different programs there. We had keynote speakers and breakout rooms with pretty much just showing people that there are different pathways into nurses, that they have a place in nursing, and really having others share their stories. So it was just a very uplifting event. Outside of that, I'm currently a 3rd-year PhD student over at UC Davis. My dissertation focuses on a program that we partnered with the Greater Sacramento Urban League on. It's called Cut to the Chase. It is a mental health therapy program that we started in 2 barbershops within Sacramento, safe places for Black men. We have attendees range from 7 to 30 men that show up twice a month to participate in group therapy led by a licensed Black therapist, male. In addition to that, we also have grant funding, which has connected our attendees with one-on-one therapy if they choose to take advantage of it. In January of this year, we launched the Cut to the Chase Crown Edition, which provides the same space within 2 salons within Sacramento. So I'm very excited to be here, very eager to have this conversation and share what little knowledge I have.
No, don't even do that. Don't even do that. You're doing so much, and it's so inspiring. And I'm excited to dig in more for folks who hear, right? Like I think a lot of times what we say in the Proximity Project is there's so much work ongoing, right? We can sit on task forces and like committees, and we're like, how do we fix this? And people are not waiting, right? Like they're getting out there, they're coming up with solutions. How do we tap into that? How do we learn from that? How do we replicate that? How do we resource those and partner? So I'm excited to talk more about all of your work. Can we bring in Taloa to the conversation as well to introduce themselves as well and share more about your work around racial justice, social justice and equity, and if you also want to share anything else about kind of how you're feeling coming into today and what you're thinking.
Yeah, I had a conversation in Halito Sahochefo at Taloa Sharp. Chatasia Hoke Mecha Chikashasaya. My name is Taloa Sharp. I'm Choctaw Chickasaw, and it is good to be here. And I have a feeling that this was intentional. This was not by coincidence that we'd come into this today, knowing what happened. Was very disheartened thought a lot of thoughts in my mind. I worked last night, so you have to kind of bear with me. I'm a little scatterbrained right now, but um, I agree with what Sonia was saying. We got to keep moving. I'm the secretary of the National Alaska Native American Indian Nurses Association and a board member at large of the Oklahoma Indigenous Nurses Association with Sonia. We what we try to do is bring our Native people together to have a collective voice, and sometimes that gets a little challenging because there's 574 tribes across the country. So, and a lot of us, like myself, are just learning how to use our voice, how to have a voice. So I'm here just to say that we're here to share and receive and to heal with each other, to hang on to an infinite hope. And just like my younger kid, I always use this in our presentations. I let him look at one of my presentations before, and it's okay, Ward. Give me something from your generation, because he's 21. I said, what do you want to say? And he says, are you ready to serve? Are you ready to slay? So even in the midst of everything that's going on, bigger picture, we're still here slaying all day, and that's what I came here, and I'm staying in here, staying in the work. Just like Dr. Grant said too, there's still work to be done, and I don't know when that's going to stop. And that's kind of a good thing. But it's good to be here with you all today.
Thank you so much. As I said, everyone's coming in here with not just what you were mentioning, but just with a lot, right? A lot going on, work and life and family. And so we really appreciate all of you for being here and making time for this. Last night, late last night, one of the alums, my wife and I co-founded an organization called Teen Sharp 15 years ago, and we help students go to top colleges. And one of our alums at Howard was on the yard, right? She's the vice president of student government, and also co-facilitates the Proximity Project Healthcare with us. She's a veteran facilitator, and she was texting and saying a lot of people were feeling defeated. And I kind of, with everything going on with me, I also was trying to give encouragement around there's history, right? A lot of history when people are earlier in this work. It can hurt even more, right? You can feel certain things can feel like they're intractable. I want to bring Dr. Grant in because in the documentary you share that it wasn't until the 40s that nurses of color could be members of the American Nursing Association.
Mhm.
And then in 2018, you became the first male president of the American Nurses Association in the 128-year history of the organization. I would love if you can talk a little about the progress and challenges that have been you've seen marginalized communities overcome, and what lessons we all should draw from that.
Well, thank you for that. Excuse me. I think if you look back, when people think of nursing, they think of us as being kind, gentle, compassionate. You really don't think of nurses as being, prejudiced or racist or, all the other adjectives that you perhaps want to apply. But nurses are people as well. And, and we see this throughout the history. When we mostly think of nursing, we automatically think of Florence Nightingale. But we fail to think that, Florence Nightingale, one of her contemporaries was Mary Seacole, who was a, Jamaican woman who came to the Crimean War where Florence was working, wanting to work beside Florence. And because she was a woman of color, she was denied that. But she is held in high esteem by British soldiers because she operated a hospital sort of up the street and around the corner from where Florence was doing her work. And you also look at other women of color who were nurses, such as Sojourner Truth. And again, Mary Eliza Mahoney, who is known as the first colored graduate nurse, to complete professional nurses training, but still was denied the opportunity to work in a hospital. after going through the training and such. So nursing has a very long history that we need to look back on and accept the wrong that has been done, and to apologize and move forward, which is what we did during my tenure. Yes, you're right. When I was elected president, I was the first male president ever in the at that time 122-year history of the American Nurses Association. And there's something wrong when an organization that has so many, well, right now we're looking at about 5 million registered nurses across the country. That is a good mixture of representation of society, but yet its leadership has been predominantly white female. There's only been 2 other nurses of color who served as president. So in 128 years existence of the organization, they've only had 3 people of color to serve as their president. There's something wrong with that picture, and as I've have said repeatedly, I hope and trust that I'm not the one and only first male president of ANA, because we really do need to be reflective of the society that we serve. But when ANA, there was the Association of Colored and Black Graduate Nurses that dissolved in the 40s with the promise that they would come into ANA and would have membership within the American Nurses Association. So they were sort of the contemporaries of the ANA, but it wasn't until the mid-60s, nurses were allowed to be members, but you couldn't hold office. So it wasn't until the early to mid-60s that nurses of color could actually hold office. And Aaron spoke about the formation of the National Black Nurses Association. That formed because in the 70s, because ANA was not willing to work on issues that affected the Black community. And nurses who were in ANA at the time were told, start your, when they put forth this agenda to say, we'd like to work on these issues that are happening in the Black community, the word was that they were told, go and start your own organization, which they did. And 51, 52 years later, they're still in existence and doing fantastic work. When I came along as president-elect, and get this now, ANA and the National Black Nurses Association, their headquarters is literally right around the corner from each other. And so there've been a period of years where there was no speaking whatsoever. And when I was president-elect and I approached the leadership of NBNA that, we need to start working on some projects together. We need to, begin to collaborate. The message that I got, from NBNA was, yeah, we're willing to work on it, but why now? We've been around the corner from each other, and all we've heard over the past 20 some odd years or so is just crickets. And I said, well, because essentially there's a new sheriff in town, and I know that we can do some collaboration together, and let's do that. So we did. And then subsequently, that led about the formation of the Commission to Address Racism in Nursing. And one of the things there were 3 things that I wanted to make sure was happening with the formation of the commission. One, that it would not be viewed as just an ANA only project. So we have the American Nurses Association, the National Black Nurses Association, the Hispanic Nurses Association, and NCEMNIA, which stands for the National Coalition of Ethnic and Minority Nurses, which is again all other minority nurses, coming together to the table, and we each would be co-chairs and have equal say around the table. So I wanted to level that playing field. The second thing that I wanted to do was to have the American Nurses Association issue an apology for its past behavior to nurses of color. And that was done. And actually, we issued the first one of those apologies at the 50th anniversary of the National Black Nurses Association. And the third thing was that this is a journey that all of us, all nursing organizations, will be working on together. And at the time that we issued the apology, some members of NBNA were saying, of which I'm also a member of NBNA as well, and some were saying, well, we'll accept your apology, but we'll watch your actions as well. And my response was, this isn't just a one-sided thing. This is something that we all have to work on together. And I consider this a journey. And by a journey, it means that it's never going to end, and that there are going to be twists and turns, and how we interact with various nursing organizations, be it Native American Pacific Islanders, be it the Hispanic nurses, be it the Philippine Nurses Association. It's going to be different because each one has been affected differently than the other, but we still are on this same journey of reconciliation, and where can we go from that? But the first thing is just admitting that yes, we there was discrimination, there was racism, but let's work beyond that. And even though we have, as we've done the work of the commission, and a lot of people have said, well, I'm not responsible for the racism that happened, or I don't see color, and et cetera. I like to tell people my response is, if you don't see color, then you don't see me, because what you're doing is you're lumping me in with every other 6'6" Black male that is out there. And my experience is different from Aaron's or from yours, Atelier, or anyone else, who happened to be an African-American male. So we have to have those difficult and tough conversations, but we got to get beyond that. But the first thing, though, is to acknowledge and to have those different conversations, and then go from there. So I don't want to take up too much time, but I hope that paints a picture there of where we've been in the past and where we need to go. I will say that the commission did put out a paper on the history of racism in America in nursing, and it's a short reading. It's only like 130 some odd pages, but very, very full. And I would encourage those who have not read it to please read that paper. It will give a very clear insight.
Thank you so much. I want to ask a similar question to other panelists. I've been on panels at different times, and people sometimes have asked kind of what keeps me motivated or keeps me to be able to persist in this kind of work, right? Social justice work, racial justice work, equity work. And I usually have a similar answer. And one of the things that I talk about is, my ancestors and those that have gone before, right, that have done this work under adverse and harsh conditions, dog sicked on them, hosed down, right? And more, right? And so I'm a student of that history. I honor that legacy, and it gives me that fire, right, to keep going. And that's one thing. But the other thing that I talk about is just seeing the impact of the work, right, and keeping the inspiration that I draw from the progress and those examples that I've seen through the work that I've been involved in. So I want to ask that to our other panelists, and whoever wants to jump in whatever order. If there's things in your work that you want to speak to that are really keeping you fired up for the work, right, in the face of all the challenges and the things that can be very deflating.
I guess I'll go ahead and go. Got kind of quiet. I think that, a lot of the work that I do, I do focus on, part of my time into Black men's health, but also the recruitment of other Black and Brown people into the nursing profession, which is not a hard sell. We're not, many people would argue we're probably underpaid, but Dr. Martha Dawson always says, she says, a person educated is a family elevated, right? And so to really recruit Black and Brown people out and understanding what that does to them financially for their family, right? I know alone in my life, becoming a nurse has really just changed the whole trajectory. I'm able to provide a lot for my children, my wife, that things that I didn't have as a child, coming from a single, parent household. I know there's others on the call that really probably resonates. But in addition to that, being present in the hospitals, and there's so much that we can add into healthcare through nursing, right? Nurses are providers as nurse practitioners, we're educators, we're researchers. We're at the bedside, we're leaders, right? We could lead organizations. And so that could definitely change outcomes in these communities, right? We see all these disparities. And so just understanding that it's not a hard sell when I reach out to others and try to get them into nursing and try to support them, because I know that it not only benefits the community, but it also benefits that person as an individual. That's one of the biggest things. And then in addition to that, knowing when we look more specifically on the project that I'm doing in the barbershops, so the work that I'm doing in the barbershops, who else is best suited to do that work? Who else is best suited to reach Black men than a Black male, right? And so I know that coming into this profession, whether it's me going into academia and research, like I have a responsibility to give back and to really do that work in that community, because I know there's not many Black men in nursing. Like Dr. Grant and I being on the call, 2 Black men, like that's super rare. Like I don't have a PhD, I don't have PhD C, but I'm in school and I'll graduate one day and my tuition's paid, so it'll happen, right? But within nursing, Black men in nursing that are PhD prepared is such a small percentage, right? And so to be able to bring that research, to be able to do the kind of research and to be able to have the conversations and reach the people, like I have that privilege, right? Others can't come into that space, right? Like you can't, like I don't stick out as much in a barbershop, right? But many of my other colleagues do, right? They're not going to be having these conversations, right? And so these are the kind of things that I know, right? And then as a father to two young boys, I understand. Shout out to my son, his birthday's today. It's not a good day for a lot of people. It's a good day for me for his birthday reasons. But that's my responsibility. And so those are the things that motivate me. And that's the stuff that keeps me going.
If I could, before Sonia responds, I'd like to add to what Aaron has said about the number of Black men in nursing. I actually just submitted an article for an organization that myself and some other colleagues started to provide leadership for Black men who are interested in leadership. But we estimate that probably of the 4 to 5 million registered nurses that are in the country, probably less than 2,000 are Black men, and Black men who are in positions of leadership. They can't even be measured. Like I think there's probably maybe 2 Black men who are deans of schools of nursing, and others who may be in positions like mine. But to look at that out of 5 million, again, there's something wrong, with that picture. So that just redoubles my effort, along with Aaron's as well, and Sonia's as well, to get more ethnic and minority people into the profession. And yes, that your comment, or quoting Dr. Dawson about a person educated is a family elevated, because it does give them, we're talking generational wealth that the person is being able to create because of the fact that you are educated. And let's face it, people found out long ago that if you're educated, then yes, you get to be elevated. That was one of the reasons why, education was not allowed for the enslaved people. Or even if you go back to colonial times, or back in the times of England, it was only the wealthy who were educated, who could read books or have books. So it's a way of suppressing individuals as well, because knowledge is a way out, and sometimes people want to suppress that. So just had to add that in.
Thank you so much. And to double click a little bit on what Aaron was saying, for others here, right, that there's people that we're uniquely qualified to reach, right, to support, and that piece, I love that you're saying that it kind of gives you strength, right, to continue doing this work, because you have it's a privilege, right? Much is given. I feel that way. Much is required as well. Sonia and Taloa as well. Do you want to also weigh in on that question? And I want to open up for others to questions. Please put them in the chat, because I want your questions as well. But I'll drop them in the chat, and I will call on you. Others on kind of what you're seeing in the work that's keeping you fired up about it, in spite of everything.
Well, to go off of Dr. Grant and Aaron, representation matters. It matters so significantly. And for me as an Indigenous nurse, I had to learn how to step outside of my comfort zone because I was never invited into any type of leadership role. And so it's been a journey as well to keep my courage up and to keep moving forward. And for me, what keeps me active is in this is that I actively support those that I love. And with my family members, I take care of a lot of my family members, just as probably a lot of you do. And, you know, my mother, she's on home dialysis. I do that for her, take care of my father. And I see the challenges that they have, even as elders. I see the challenges that my community have within our healthcare system. And a lot of them, they come to us. They see me because they know I will speak up. And so we get to hear all those stories and we carry those stories with us. And for me, it's an honor for me to be able to be a voice for them because a lot of them don't know how to use their voice. And that's my role, is to serve others as a nurse, as an Indigenous nurse. And I just want to actively support my community, if that makes sense.
It does, it does, it does. Beautifully said, Taloa.
Yeah, to go along with what Sonia was saying, uh, just like probably with a lot of you, it's in our culture, it's in our blood. We take care of everybody. And to go along with what you said a minute ago about the responsibility, I heard off of a cartoon, one of my kids' cartoons, with great chocolate comes great responsibility. But and it is that way. But for us though, what keeps us motivated for me is it's right here at home. We've lost a lot of people and we continue to lose a lot of people to things that seem unreal. Just from a personal note, and I'm not going to get emotional today. I'm not. I lost a nephew. He didn't quite make 21 in 2021. I lost another nephew who was 27 to cirrhosis. A couple years after that, I lost a sister, and Cheyenne Way, and that's my ex-husband, but she's still my family. She was our sister. To accidental overdose to fentanyl. So these are things that are home. These are things that are family. So just like Sonia said, we're the voice. I'm learning that, and it's taken me a while to be comfortable with that, because we've been in situations where we were silenced. Even within our own communities, even within our own hospitals. And that's something too that we try to educate on and try to recruit to, just because, like Sonia said, like Dr. Grant said, Aaron said, representation does matter, especially within our communities, because in a lot of Native communities, there's hospitals that are available to us that only serve Native people. So you have people that come in from several different tribes all over, that come to those hospitals, and you have a lot of staff that don't know anything. They don't know basics of culture. So, and that still happens today. You know, a lot of people, you know, they've told us, oh, that happened so long ago. Why can't you get over it? Well, it didn't happen so long ago. Like I said, I just lost a sister, you know, last couple years ago, last year, within these few years, and it wasn't to COVID. It's to diseases that are still prevalent with our people that shouldn't be. And people have normalized it so much that they think that we're comfortable with seeing all the death, with experiencing it within our families. And we're not. I'm not comfortable with the status quo. I'm not comfortable seeing all the diabetes and the heart disease and the suicide and the substance use. I'm not comfortable with that. That's not normal. That it should never be seen as normal. So that's what keeps me motivated, no matter what I see, no matter what the circumstances look like. That's what keeps me in the fight. It's right here at home. It's right here in my family. I've said it before, like it's an ever-present reminder of why I do what I do.
Thank you so much, and sending you so much love for all of that. And I want to open up for a few questions. We don't have as much time, but I saw one from Tatiana in the chat, and if you can direct it at one person, so we can get a few questions in before we wrap up.
Thank you so much. Thank you so much, everybody. What an inspiring conversation, especially today. Such an honor to be in this place. I come from a space of education where often people wonder, well, isn't teaching just good teaching, right? Like, why do we need teachers of color? What really is so different? So I'm just very curious, and I'll direct it to Dr. Fraser, because from watching the documentary, I was there is a beautiful moment of care that Sonia provides to her mother. And I will ask you, like, can you break it down for those of us who are not in the nursing space or in the medical space, or for those of us who are in healthcare space, but just really are not sure, what does culturally competent, culturally relevant, culturally responsive nursing care look like? What is different about that?
It would be what I would call cultural humility, where it's an ongoing journey. It's just not like this month is Native American Heritage Month. This isn't the only time you're going to learn about Native Americans, and it's not the only time you're going to meet a Native American. It's year round, all the time. It's a consistent learning process that we do every day, each and every day, because none of us know everything, and none of us should ever claim to know everything. But that's how I see the clinical setting, the hospital setting, is more like cultural humility, an ongoing journey.
I think it's also, if I may add to that, I think it's also essentially meeting the individual where they are at, and asking. It's almost like, you remember the commercial for I think it's UPS. It says, "What can Brown do for you today?" It's in essence, you're saying to the patient, "What can I do for you today? How do I understand how your culture embrace health and healthcare?" And knowing you want to individualize that care, if you will, to that individual, because you want them to be part of the care plan. You want them to have a say, or know that that they have a say in the ongoing care. And but part of that too is how you speak with them, how you interact with them. Do you look them in the eye? Do you set down on their level? As opposed to standing over the bed in sort of an intimidating fact, or implying, I know more than you type thing. It's taking all that into consideration. It's almost like the way I tell my students is, think of it as if this is the way you'd want your mother or grandmother or any other family member treated. When when you're there, you want to respect the individual for who they are. And embrace their culture. And if you don't know anything about their culture, ask them. That's the best way for them to really be endeared to you, is the fact that you've taken time out of your busy day to want to know, what is it like to be, a member of your culture, or how does your culture view sick? Is it, yin and yang type thing, or is it, good versus bad, that type thing? It will help you as you're planning the care for that individual going forward, because a lot of people do not embrace westernized medicine, or even if they do, they're still sort of anxious about it. So you need to figure out, is there a way that maybe we can blend the two together as well as we move forward?
Yeah, and I'd like to add to that, if I could. Like, for me, it's building trust. Because regardless of my culture or anybody else's, that's what I do with patients, is you try to find every which way possible to connect with another human being. asking questions, getting to know them on some level. I mean, you don't have to know them personally or anything, but just basic questions to try, like we've said it, me and Sonia say it all the time, is planting seeds of hope. Because sometimes you have people who come in who don't have any and they don't know what that looks like. So we have to paint that picture for them. So you ask questions, you see their body language, you see how their family interacts with them. You see the tone of voice or the speed of which people talk, and you reciprocate that because that's how they want to be communicated. Like how someone communicates is how they prefer to be communicated in return. And it's a reciprocity, and it's a respect for another human being, and that's regardless. I feel like regardless of any culture, that's how I approach it too.
Thank you, Shay. I'm going to ask Shay if you can introduce yourself and ask your question, which will be the final question. So everyone can kind of give me your response. All the panelists can give you a response to that, and then we'll close out.
Okay, good afternoon, everyone. I'm Shay Scott with Henrietta Johnson Medical Center. My question was really just, we're a group of people who are doing a lot of great things on an individual level, but on a collective level and on a system level. What's the best way for us to go around and make a greater impact on the system at large?
Whoever wants to
Well,
start.
I don't. No, I don't want to feel like as though I'm hogging the conversation here, but I think the best thing is to hold the system accountable. We have practice standards, guidelines, things of this sort that organizations have to adhere to. We can do the same thing when it comes to addressing things like racism within the profession, workplace violence, things like that. So those accrediting agencies, those like the Joint Commission, the magnet status or pathway status, or any of the other accrediting agencies that would essentially hit a hospital or a healthcare system in the pocketbook. As long as they receive federal funds or whatever, then begin to demand that they put in place things that will address these issues. And also talking with your members, your elected officials. As nurses, again, those who've heard me talk, you probably have heard me say plenty of times that, as nurses, we're good at advocating on behalf of our patients, but we do a piss poor job advocating for either ourselves or for the profession itself. And we really need to do that. And one of the ways is to consider becoming a legislative liaison for, your member of Congress, or even at your state level, your state representative or state senator, and talk to them about healthcare issues. Because a lot of times the information they get is from a lobbyist who has the interest of his or her client. And it may not be that it's good for the community. And if you let them know, I am one of your constituents. This is how, if you vote on this particular piece of legislation, this is how it's going to affect me, my family, the community that I live in, and we deserve more. And sometimes they forget that they are our employees. It's not the other way around. We elect them, so therefore they are our employees, and we need to exercise that that right to be able to sit down and have a conversation with them, go to the town halls that they're having, even though sometimes you find that they're being held secretly, but you can call and get their schedule on their calendar. Where is so and so going to be meeting, or who are they talking to, and go to those places as well. But that's what it's going to take, is a groundswell of people essentially working with these accrediting agencies, these or agencies that that helps to set the standards, so that we begin to address it that way. And it's a long, slow process. It's not to say that it can't be done. It can be done, but it is a slow process.
Thank you. Any closing comments as well from other panelists?
Yeah, I agree with Dr. Grant. It is going to be kind of a slow process. You know, where we are now in healthcare was not a situation that was created overnight, and you know was sustained and reinforced over decades. Additionally, I do agree about holding organizations like our magnet status. I know things that are forced are sometimes not sustainable, but these are goals that organizations want to reach, right? And so if we could look at, what are the qualifications for magnet status? Like, are these things achievable? Are they like, how are we coming up with that? They say, oh, create a DEI council, for example. Like, okay, what are the deliverables? What are the responsibilities of this council? Or does it just need to exist in order for you to qualify for some kind of magnet status? That's not helping anything, right? So I think that looking at that, where organizations will work to make or implement these changes in order to achieve those kind of statuses like magnet. I think we could look at on an individual organization level is how is your organization working in community? Are they working to empower? I think a lot of times what we see is organizations, and I know we have 60-something people, so I'm not talking about my own organization. Don't get me in trouble. I need this job. But are we like, a lot of times they say, oh, we need to do a flu vaccine or we need to do this, and your organization wants to create a whole program when we have grassroots organizations that are doing it, that could use your support, that can use resources. Maybe they just need gloves or access to vaccines, or there's so many things that we can provide as huge organizations to these community organizations that are already have relations, already doing the work. Like, we could help to uplift them, right? Sometimes it's just sharing their flyer on our social media. It's like there's these simple things that we can do to really make an impact, right? These organizations have been around for a long time. I'm sure every community, anyone on this call could think about 3 or 4 community organizations that do amazing work that could just use just a little bit more help, right? And it doesn't mean go in and like, how can I solve this problem? It's like, how can I help you? Tell me what you need and how I could be of service to you, right? I know that with us, and we talked about how we can collaborate together. That's where Breaking Down Barriers comes from, right? This collaborative impact. We're all nonprofit. We're all trying to get meet the same goals. Why not work together? Why not collaborate, right? Maybe I have relationships and I could find a facility, a space, and you have access to, the people and volunteers, and like, let's just get it together and work together and accomplish this goal. I think sometimes it's all about like me. I want me on the front. I want my name the biggest. And it's like, we need to just work together to get this, that's the goal, is to work together to accomplish this. Like, it has nothing to do with the outcome. If everyone's just here to claim the reward, the reward is all of us winning. That's how I see it.
Beautifully said. I know we're getting over time, but Sonia and Telo.
I just call it making relatives. That's what we believe in our cultures. You just make relatives with everyone around you, your community members, and just collaborate together. And then with that force, you can accomplish anything.
I love that. I love it. Making relatives. Telo. Final word to you, Telo.
I'm sorry, I'm having problems with my phone.
No worries at all. Say any final word for you. We can't hear you now. I think you're muted.
Hear me now?
Yep.
Okay. Final words. I think I lost my train of thought. Just like I said, hang on to hope. We see the despair, we see whatever, but infinite hope. Be creative, keep your creativity. I know in another panel discussion, someone had mentioned that we have a lot of Thundercats coming up, this new generation. So to me, it's like, fight smarter, just like we work smarter, we fight smarter too.
Thank you so much. Thank you to all of you, and thank you to those who persisted to the end. I think Morgan already in the chat because he knew he was running out of time. He announced who will be getting the book, so hopefully you saw your name. Let's give some love in the chat and to our panelists. I hope that you will definitely check out the documentary and you'll reach out to them and connect and find ways that you can partner, support their work, learn more, bring them to speak at your organization. But really grateful to all of you for making time today. I hope you all are also taking care of yourselves, protecting your attention, your energy. This is as it was said many times, this is not a sprint, right? This is a marathon. There's so many different layers to this. You know, Morgan and I were talking about that, right? I've shut off, I can't be in everyone's chat. I can't do all the postmortem of this, right? Like I really need to, we're all doing great work here, right? Put our head to the work, check in on our people, build community, and let's keep making progress. So thank you to you. We have an open session at the Proximity Project this Friday. If you have time, please check us out as well. And we're looking forward to doing one of these again sometime soon. Thank you. Have a great one. Thank you.